Hello, everyone. Welcome to today's webinar from the American Institute of Dental Public Health, which is going to present leadership education and research programs for which applications are currently open to run from 2023 to 2024. My name is Stacy Chazen, and I have the honor of leading the leadership and education programs for AIDPH, and I'm going to be the host for today's webinar. Next slide, please. So to get started, we're gonna, here's today's agenda. We're gonna cover some housekeeping items. We're gonna give you all a brief introduction to the American Institute of Dental Public Health. And then my colleague Liz Flannery and I are gonna share with you an overview of 3 current opportunities that are now open for applications: the AIDPH Federal Service Internship, the AIDPH Summer Research Fellowship, and the AIDPH Dental Public Health Leadership Academy. And after we walk through our presentations, we'll have some time for Q&A. Next slide, please. So to get started, today's call is being recorded. We ask that you type your email address and organization name or school name if you're in school in the chat for recording. The slides from today's webinar will be posted on the AIDPH website. And if you have any questions about Zoom during the call, please chat with our Executive Director, Annalise Cothran. I will also ask that if you're so inclined, please add your pronouns to your Zoom name. With that, I'm going to turn it over now to Annalise Cothran, Executive Director of AIDPH.
Thanks, Stacy. I appreciate it. Hi, everyone, and welcome. I would love to share a little bit more about AIDPH in case you're new here and maybe you haven't heard of the work that we've done before. AIDPH is a 501c3 nonprofit focused on the science and education of dental public health. And through that focus, we design educational programming that supports learning and implementing strategies for underserved communities, historically excluded communities, and marginalized people. So our mission is to foster professional excellence and advance innovation in that endeavor. And we hope that you'll join us in pursuing our mission of an equity-oriented oral health workforce prepared to lead. Our core communities of focus include people living in rural areas, veteran oral health, LGBTQIA oral health, and people living with disabilities. We also pursue endeavors that are considered crossovers in these areas, for instance, LGBTQIA+ veterans. And we share these core communities of focus with you because we infuse them into our educational programming and offerings, which is what we'll be thinking through today. In particular, our Summer Research Fellowship will have a research emphasis on these core communities of focus, particularly with veteran oral health. And with that, Stacy, I believe I'm turning it over to Liz. Is that correct?
Yes, my pleasure to introduce to everyone Elizabeth Flannery, who is an education specialist with AIDPH, who will talk to us about 2 of the programs today. Take it away, Liz.
Thank you, Stacy. So yes, I will be talking about Federal Service Internship, or FSI, and we can go to the next slide. This is an annual event that we have done in the past and has been on a bit of a hiatus due to the pandemic because it is an in-person event. So we are extra excited to be bringing this to everyone this year and are really looking forward to an exciting week in DC and having a big, robust cohort to participate. So again, looking at the overview, it's a week-long immersive learning experience in DC in person. We will be visiting agencies, federal agencies, to learn about the roles and operations there and to engage with the leaders there. The tentative schedule for this year, as many of you may know, there are a lot of acronyms that can come with federal agencies. So we have that throughout our program information. I'll just name them here quickly, but tentatively we'd be meeting with the Food and Drug Administration, the Indian Health Service, Centers for Disease Control and Prevention, Education, National Institute of Dental and Craniofacial Research, National Library of Medicine, U.S. Department of Veterans Affairs, U.S. Department of Health and Human Services, National Institutes of Health, and Health Resources and Services Administration. So again, you can see how robust and exciting the program is from that list. And this program is really for folks who want to pursue a career in policy, federal service, and or government. And it's open to students and early to mid-career dental public health professionals. And we can go to the next slide to take a look at our learning objectives. So what we want people to come out of this week with is articulating the roles and operations of those federal agencies we named, describing the different federal service career development pathways. We really want you to understand what the opportunities are and how you get to them. Describing key state and federal policy issues that affect dental public health and the oral health of vulnerable communities. Again, going back to what Annalise spoke about at the top of this webinar, those communities of focus for us and how they're impacted. And identify effective federal agency approaches that address target populations, strategies, tactics, and desired outcomes. Really learning those from the leaders that we'll meet with at these agencies. So the benefits of this program is, again, understanding the federal agency roles and operations, looking at those different career pathways, both knowing what they are, what your options are going into dental public health, federal service, and how to get there, and becoming a part of a cohort with networking opportunities. And I just want to speak about this specifically a little bit. Networking opportunities can be a little bit of a buzzword sometimes, but it's really important. We talk a lot about this in our educational programming. It's really important to connect with your peers, and we've built opportunities into the programming to connect with the cohort prior to meeting in person. You'll be together in person for a week, and then we hope to keep you connected afterwards as well. Another benefit is having the opportunity to network and connect with these national leaders that we spoke about at all of these agencies. You'll have a direct connection and an opportunity to engage them and really see the behind the scenes and take a peek behind the curtain, so to speak, of how these agencies work and who is working there. So we can go to the next slide and look at the program schedule. Again, we've already met with our expert faculty leaders from all of these agencies that we listed off at the beginning of this. They're all really excited at the programming, and just taking a look at this schedule, you can see that it's a very busy, robust week that will be really exciting to go visit all of these different agencies. We can look at next slide for logistics and cost. So there's a few different components to the cost of the program, both tuition and travel and lodging. Participants are responsible for travel and lodging. How that will work is AIDPH will do a block of rooms at a central hotel where everyone will stay at, so we can stay connected and be together. We'll share that information at the beginning of July, and participants will then be responsible for booking that information. We don't have the exact cost yet, but we estimate that the cost of hotel rooms would be $150 to $200 a night. We would be looking to make it as affordable and economical as possible. Then there is also tuition for this program, and the cost of that is $1,800 this year. We really encourage participants to request funding from their schools and organizations, and we've provided template letters for you to do that. So we can speak more to participants about that once applications come in. We can go to the next slide and talk about selection criteria. So we want to see a commitment to dental public health and increasing access and equity in oral health care. Again, back to what Annalise was talking about AIDPH and who we are and what our vision is, and the communities we're working with, as well as a commitment to working in policy, government, a federal agency, etc. And just to note, we really want, with thoughtfulness and thoroughness, we think of this as an opportunity for you to really show us who you are. We want to learn about you and your work and your unique perspectives. So I encourage you to let that shine through as you approach your applications. And a commitment to the program format and expectations. I think looking at the schedule and talking about the long list of agencies we'll be meeting, you can really get a sense that this is a fast-paced, busy week. So we want to make sure folks have an understanding of that. They're committed to being engaged fully for the week, as well as engaging with their peers for those networking opportunities and the leaders that will be presenting during the programming. So we can look at the timeline. This is included on our website as well as our program materials. If you've looked at those before, you may notice there's a little bit of a tweak. We extended the application deadline and adjusted other dates accordingly. We want to make sure that folks have enough time to apply. So if you have peers or friends who you know are also interested in applying, please share that information. This will be updated on our website and the program materials as well. And I also wanted to just share part of why there's a long lead time here is there is a lot of coordination meeting with federal agencies. We need to make sure everyone has access. Each agency has a different security protocol, and the longer lead time with this program between applications and the program actually happening gives us time to communicate with participants and make sure we have all of those logistics and information pieces lined up. So we will now move on to the summer fellowship, and if questions come up, we'll address them at the end, but also feel free to put them in the chat. I think folks were saying that in the chat as well. So looking at fellowship, we can go to the next slide for overview. The fellowship program is 100% virtual. It is an opportunity to work with us in education, science, research, and advocacy programs. It's 10 weeks long. And in order to participate, you need a commitment of 5 to 7 hours per week. And that includes the weekly seminars as well as some pre and post work as well. So each year we make the fellowship projects based on a combination of who the fellows are as well as what AIDPH has going on as far as research projects in the pipeline. And this year, the 2023 fellows will contribute to a special research project for veteran oral health in Iowa, and it's supported by the Delta Dental Foundation of Iowa. So we're really excited about the project for this year. And it is for new graduates, advanced education students, and incoming and outgoing public health residents with experience in research. And we'll talk about the research experience a little bit in the requirements as well. So looking at the program components, we spoke a little bit about weekly seminars. Again, everything is virtual. We did have some questions come in about that. The weekly seminars are expert faculty and peer-led. So they'll mostly be pre-planned, but they'll shape up a little bit as we get our fellows in and figure out what those peer-led pieces are. There'll be flash mentoring sessions that happen kind of throughout the 10 weeks, and those times will be shared. And I just want to speak to that a little bit. I think that's one of the most exciting parts of this experience. We bring in experts from our staff, from our board, from our partners, and it really covers agency, government work, public health expertise, research. In the past, we've done CV reviews, sessions with policy professionals and public health experts, and it's a little more informal and really an opportunity for fellows to directly engage with these leaders in the field and can just really get some robust information on career pathways and advice on how to pursue different areas of interest for fellows. And then finally, you participate in a research project that's feasible to complete in the 10-week timeframe. And again, that will be part of that special research project that we're currently working on. So we can go to the next slide. So benefits. With the focus on our special research project this year, we expect you'll come out with a sharper research skill set and a deeper understanding of working with marginalized and historically excluded populations. And you'll become part of a cohort with ample networking opportunities. Again, back to that networking conversation of how important that is for our programming. we say it and we say it again, we don't want it to just be a buzzword. We really encourage folks to connect during the programming, connect pre and post. And I just want to say, as someone who is working for AIDPH and someone who joined AIDPH as a practicum student and participated in the fellowship program, I can kind of personally speak to how effective this can be for the fellows. I've really seen how last year's cohort has networked, stayed in touch, followed their research projects, continued to participate in both educational and professional capacities with AIDPH. So I can't speak how strongly that of an opportunity that is. It's really exciting. Again, participating in those flash mentoring sessions with leaders in research and dental public health, another great opportunity. Again, networking, but also just learning and really being able to soak up what these folks have is an incredible opportunity to have a one-on-one with them. So we can go to the next slide to look at our selection criteria. So we spoke a little bit about research. We have a fairly specific research project this year. So again, we would love for you to share and tell us what your research skill set is and what your demonstrated experience is there. And I will say a similar comment to FSI is really, we would love for you to take this as an opportunity to show us who you are and share who you are and what your unique perspective is. So just let that shine through in your application questions. We're excited to learn about all the applications and see who you are. And we can now take a look at the timeline. So I'll share a little bit here. Applications will be due. We will be doing a second review piece here once folks have passed through the initial piece of review of applications. We will ask applicants to do a short video interview. In the past with the fellowship program, we have done live interviews, but we found that this might be a way to streamline things both for staff and fellow applicants. And if you make it to that phase of the application, we will share detailed information. It will be a fairly short piece and will give you ample time to complete that part of the application process. And we're looking to start the summer the week of June 19th. And again, it would be a 10-week program that goes through the end of the summer. So now we can go on to, I think I'm passing it back to Stacy to talk about DIPLA.
Thank you, Liz. And I know a few folks have joined us since we started today, so I'll just call out a few things. The slides and recording from today's webinar are going to be shared on the AIDPH website after today, so if you missed any part of this, you'll have an opportunity to catch up. Please post any questions you have in the chat, and we're going to get to those at the end. We'll invite people to come off of mute at that time, or we'll read out the questions in the chat. And again, I'm Stacy Chazen, and I'm Director of Education and Leadership Programs for AIDPH. I will now talk to you about the Dental Public Health Leadership Academy, or what's affectionately become known as DIPLA. Next slide, please. So what is DIPLA? DIPLA is a 12-month leadership development program that we've designed for early to mid-career dental public health professionals and students. We are opening applications right now for the second cohort of this program, which will include up to 20 participants. And the goals of the program overall are to build the knowledge, skills, and capacities of DIPLA participants to be leaders in their fields in the spectrum of dental public health. The learning objectives for DIPLA are to describe and understand pathways to developing key competencies of dental public health leadership, to understand and develop strategies that reflect their individual leadership styles for each person, describe the key state level and federal policy issues that affect dental public health and the oral health of vulnerable communities, as well as effective advocacy strategies related to each, and to apply the key competencies of dental public health leadership to a project they undertake during the course of the year that will address a key challenge in their organization or community. DIPLA has a number of components that all they intersect and support one another and allow participants to have a multidimensional, really engaging experience over the course of the year. This includes monthly 2-hour seminars These take place during the workday. I want to flag here. So they generally take place from 12 o'clock to 2 o'clock p.m. Eastern time on a designated weekday. And more information about this is available in the request for applications. Folks are required to attend at least 10 out of 12 of those seminars. Monthly flash mentoring sessions, which are optional components, and folks need to take part in. Actually, they don't need to. These are all optional, but highly encouraged. These are another hour-long event that we offer. The program overall is a mix of didactic, case-based, and hands-on learning. And what that means is we bring in subject matter experts to supplement our faculty. We draw from the faculty here at AIDPH to teach folks expert-based concepts and frameworks and how they can apply that to their worlds. To their learning, to their organizations, to change that they're looking to affect in their communities. We also incorporate case-based learning, and that can be drawn from cases that either we supply to the group or that participants bring so that we can help them problem solve a challenge that's going on in their worlds. And there's a lot of hands-on learning, so I'm going to get to that in a minute. There are ample networking opportunities, both with national leaders who come in and serve as our flash mentoring or join us for more informal get-togethers, and also networking with cohort peers, which is both structured and unstructured. And we also provide you with support for planning and implementing a transformation project using the tools and frameworks that we provide over the course of the year. So that means that we're giving you a template with various change frameworks that we teach you how to use and give you feedback around, so that by the end of the 12-month period, you have designed and in some cases begun to implement a project that is geared toward addressing a challenge or a target area of change that you've identified. So this past year, our 2-hour monthly seminar topics have been fairly wide-ranging. And as you'll see here, they include the bulk of them, or it's a mix, but more of them are focused on overarching leadership topics, like understanding your personal leadership style, project management, women in leadership. And then we also had are continuing to have a few that are content-based. So we had one that was focused on dental public health and Medicaid policy. Another one is going to address nonprofit development and fundraising. So it's a mix of how can you grow and apply your skills as a leader in whatever space you're operating with. What are some of the nuts and bolts, the content that you need to have to be an effective dental public health leader? These are the topics that we had for this past year. It's the expectation that many of these will carry forward to the next cohort year. However, we take a look at the ultimate cohort of individuals who are selected in a given year and do some follow-up around what topics are most pertinent to you. So it could be that our cohort for the coming year lives more in a particular space of dental public health practice and learning, or are more interested in certain leadership development topics than others, and we adjust accordingly so that we're having this program be as useful and valuable to the participants in a given year as we can. I also want to mention, I don't think I said this yet, that this program as well is entirely virtual. So there is no in-person expectation here. Our flash mentoring topics. So again, these are the 1-hour calls that are optional that take place each month. These topics are more geared toward career development. We've had speakers come in from the AIDPH board, from AIDPH's Corporate Leadership Council, and elsewhere in the space to have more informal conversations with participants. They generally include a brief prepared presentation, but then the calls are really more a discussion. So for example, we had a wonderful session that was led by Dr. Mike Monopoly, who sat on our Corporate Leadership Council, about building your professional network. And he talked about ways that he's networked, ways that he shows up at conferences, does follow up with people after he meets them, engages in conversations, and over a decades-long career has built for himself a really dynamic and diverse professional network. And he offered suggestions to the group on how they could do that as well. And then most recently, we had a whole session where we brought expert faculty in to give participants feedback on their CVs or resumes, to say, here are some things you might want to think about in terms of how it's presented. Here are some places you might want to take your career or experiences you might want to have to add to your CV, depending on what your ultimate career goal is. So both the nuts and bolts of the CV itself, but also what can you do to develop your own individual CV to help get you where you want to be in the dental public health space. And these topics as well will be designated based on the interests of the group selected for next year's cohort, or the coming year's cohort rather. Next slide. So what are the benefits of taking part in DIPLA? You will build competencies in the core leadership domains of dental public health, gain a solid foundation in dental and broader public health policy and advocacy, gain tools to apply leadership and policy learnings to a current challenge, join a cohort with ample networking opportunities, supporting professional connections now and well into the future, connect with national leaders and subject matter experts. And then I also want to mention that participants have the opportunity to earn CEUs for each session they take part in, each seminar they take part in rather. And folks who complete the program will receive a certificate. So this past year has been the first year we've offered DIPLA. And accordingly, we were especially interested in checking in with our participants at mid-year to hear how it's going for them and how we're doing. This is something that we plan to do in future years as well, but especially this year, as we were pilot testing this new offering. And we were so pleased and really heartened to hear very high levels of satisfaction across the 15 participants with how the program has supported their ability to connect with their peers and to grow their professional network, both among those peers and others who've come in as presenters and faculty. They were really pleased with the alignment of the curriculum with their individual professional development goals and needs. And we're really pleased with the mentorship that's been provided by faculty, as well as from their peers. And sharing here, one quote that jumped out at us from one of our participants: most valuable to me has been being part of a cohort and the networking opportunities that come from that. And the content's been very valuable. The leadership concepts have become unconsciously ingrained in me. DIPLA is helping me learn how to connect with people and understand how they think. And this is something we've really seen. We hear from our participants at our monthly seminars and in our flash mentoring sessions immediately how they've applied what they've learned. How it's changed the way they approach people and teams and problems, and how they present themselves as leaders pretty immediately, which is a pretty wonderful thing. So it's not just something, they're not just taking notes in a notebook or filing away handouts that we give them, but they're learning and are applying these takeaways in real time, which has been great to hear. DIPLA is open to dental public health students, residents, and professionals in their first 5 to 7 years of their career. And I want to offer a couple of clarifications to this. We have people taking part in this year's cohort who are maybe 20 years into their career, but only for the past 5 have they worked in dental public health in that space. So it's, when we say early to mid-career, we're talking specifically about your dental public health career. So if this is a second or third career for you, and you fall into that category, then you are eligible to apply. If you have more than this number of years of experience, I encourage you to be on the lookout for future programs that we're going to offer that will be for more advanced or more seasoned dental public health professionals, but this one is for folks who are in that earlier stage of their dental public health career. We encourage applicants from traditionally underrepresented and historically excluded communities, and are committed to having a diverse set of perspectives and backgrounds and skills and voices overall at the table. And I'm proud to say that's something we did really well with this first cohort, and it's made for some really rich, wonderful discussions and peer-to-peer learning. The cost for the 12-month DIPLA program is $1,000 for students and $1,500 for working professionals who are not currently enrolled in a full-time educational program. We encourage you to seek financial support from your educational institution or employer. If you need help meeting the tuition requirement, we've provided in the request for applications a letter template that you can use, that you can customize to communicate to your institution or employer what benefits you will get from the program and what it includes. Please reach out to us if you have any questions about that. And then we also have some very limited scholarship funding available to those who have demonstrated financial need. As we're reviewing applications for DIPLA, here's what we're looking for. We're looking for demonstrated self-awareness of leadership strengths and opportunities for growth, demonstrated awareness or understanding of the importance of and opportunities presented by leadership in the dental public health field, the overall thoughtfulness and thoroughness of answers, and a demonstrated commitment to completing the program and participating fully. One thing I want to underscore here is there are, when we're talking about your leadership strengths and what you're hoping to get from the program and asking about what you think challenges and opportunities are in the dental public health space, there are no wrong answers. It's really a way for us to get to know how you think, to see how you've applied the experiences and education that you've already had to questions like this, and to demonstrate to us that you've given a lot of thought to what you want to get out of the program, what you want to put into the program, and where you want to be using this to advance your career trajectory. Next slide. So here's our program timeline. Applications are due May 31st by 5:00 p.m. Pacific Daylight Time. We'll be notifying applicants of acceptance decisions on or before June 30th. And the monthly full cohort calls and the program overall will begin in September of 2023 and conclude in August of 2024 with a final call of the cohort where folks will be presenting the projects that they designed and undertook over the course of the year. Next slide. So any questions? I've seen a number of questions coming in the chat. And I think, okay, so, and I'm just going to read some of these two that have been answered already. Is the fellowship program for dental public health residence programs or MPH dental streams? And Annalise answered, our summer research fellowship is open to all advanced education students, including MPH and dental residency students. What other questions can we answer? And you can put it in the chat or feel free to take yourself off of mute.
Good afternoon. Can you guys hear me?
Yes, we can.
Oh, awesome. Awesome. I don't have video, so I apologize for that.
That's okay.
Thank you for the presentation. Thank you so much. I came across the table at the National Oral Health Conference, and this is one of the things that I was highly interested in. So I'm glad that you guys did the informational session. I do have two questions. One's for myself and one's for another colleague. For the federal service, well, both for the federal service one and the internship, as well as the other one that is actually, well, we have to, it has a tuition. Do a lot of students just usually, or just participants, get some kind of funding, or are there people that actually pay out of pocket themselves? Like, are you guys familiar with that? And then the second question is that the other program, the fellowship, which is paid, is there like does it depend on how much work you do? It depends on how much you're compensated?
Annalise, I'm going to turn to you to take those.
Sure. Thank you for the question. Happy to add some additional context there. For both our Dental Public Health Leadership Academy and the Federal Service Internship, I I would say it's a mix. Number one, the Federal Service Internship is relaunching in person. Previously, whenever we had this experience, it was actually limited to just dental public health residents. And we've since expanded that criteria as we've relaunched it in person. So I guess my comment to that is traditionally, education programs have been able to support students' participation in that. And this time around, we have created tools and resources to help solicit funding and sponsorships from educational programs or your workplace to help mitigate the costs of tuition and travel. So though we have this, I think, available on our website, and also we're happy to work with you if you have a particular concern and would like to solicit sponsorship from either your educational program or from your workplace. We're happy to brainstorm ideas there. For the summer research fellowship, that is $1,000 stipend. It is not dependent on work, although there are criteria that need to be met in order to be a fellow of the program, such that you complete your research activity, that you attend seminars, etc. So there are some expectations that are associated with that $1,000 stipend, but we're able to offer $1,000 to 3 students who participate.
Thanks, Annalise. Did that answer the question?
Yes, thank you so much. I appreciate it.
Anyone else?
I would just like to thank all of you for the great overview. Appreciate it.
Our pleasure. We love this stuff, I'll say. We're pretty passionate about it, and I'll speak for myself and say I feel really lucky that I get to do this work. And every time we have one of our DIPLA seminars or flash mentoring sessions, it's just pretty special. It's a very safe learning space. Our participants really show up vulnerably and willing to share what they don't know, to ask questions they have, to teach one another. And if you've ever been in any type of group learning cohort like that, it always takes a little time for folks to settle in and get comfortable. This group really took off from the start, and they're so willing to share with one another, talk about their challenges, talk about, do some collaborative problem solving together, and just acknowledge that, yeah, it's okay to struggle with that. It's okay to feel like you don't know what to do, or to feel, given where folks are at that different points in their career, maybe to struggle to feel like they have a voice at the table. And so we talk about how can they do that, feel more comfortable doing that. One of the things we did this year with DIPLA that we plan to do next year as well is we started off by giving everyone the opportunity to complete an Enneagram assessment, which is a personality and personal leadership style tool, and then connected them to a coach who facilitated conversations with each of them individually about their Enneagram results. And then over the course of the cohort, we've referred back to those and done sessions where we talk about, okay, depending on your Enneagram type, here are some communication challenges you might have, or communication approaches you might wish to undertake. We talked about the implications of Enneagram types for how folks approach conflict and team dynamics. So, and I'll say too that we on staff and faculty did them ourselves, so we also had the opportunity to see ourselves in that work, and the participants have been really appreciative about having that tool at their disposal.
Stacy, I was just trying to think through some of the questions that have come in to all of us over email over the past few weeks, and I think we covered them. We pre-talked about them, so I think we covered them in the presentation, but I just want to reiterate here. I know there were some timeline questions that came in, and we had a slide for each program on the timeline, but that information is also available on the website and the request for application documents for each program. So I just wanted to restate that, so that's easily accessible for everyone if you have any questions about that afterwards. And as Annalise said, you can always also send questions to the program's email. And another piece is obviously access is very important to us. So if you're having any sort of difficulties accessing or any questions about accommodations that are needed, please send those to the program's email as well. And yes, we are recording and we will be posting it to the website. So please share that. I know you had mentioned colleagues, please share with colleagues, with peers, everyone you think would be interested.
Great, thanks for that, Liz. And thank you to my colleague Christine, who's put this back up. QR codes, which still amaze me that all these dots and dashes and shapes can just take you to a document or a menu or an application. So please reach out to us. programs@aidph.org is the best way to do that if you have any questions. And we look forward to seeing your names on some applications. So thanks for joining us today, everyone. Have a good Monday. Bye-bye.